Good morning. I am Janelle Hahn from your local American Lung Association here in Central Florida, and we are excited for today's lung chat. We're talking to Dr. DaSilva today with AdventHealth, and we're talking about some really incredible new technology. This is really going to be important for our lung cancer constituents. So really, I'd love to see just how far lung cancer technology and innovation is coming. So we're excited to be here, and thank you for being here with us.
Thanks for inviting me. I'm glad we had the opportunity to finally meet and have something for our audience, which is so important for us. You know, Janelle, I've been doing this for 25 years, and very rarely we come across a technology that would improve survival in our patients. I mean, we always often talked about techniques as surgeons, or new modality of therapy, or even immunotherapy. Because technology is a different sector in which we intervene into patients and trying to extend their life, their survivorship. I mean, no matter how we do our surgeries and treat our patients, I think once in a while technology comes up will change that. We call it the tipping point. So we're very happy to have partnership with Monarch in acquiring some of their newest technology that will tie in with our total lung care program in AdventHealth.
Absolutely, and lung cancer being so important with early detection, better treatment options, and we've at the Lung Association, through our State of Lung Cancer Report, have really pointed out that we need better early detection here in the state of Florida, that we can be doing better for our lung cancer patients. So let's really get into some of this technology.
Sure.
So what is the Monarch?
So the Monarch is a bronchoscope. It's what we call the state-of-the-art leading-edge technology that allows our providers, pulmonologists, interventional pulmonologists, thoracic surgeons, to actually allow us to do early diagnosis of lung cancer in very challenging anatomical locations inside the lung. That's number one. Number two, it will tie in with our lung screening program. As you know, I just mentioned that lung screening, not only in Florida, but across the country for lung cancer patients is really low. So we're screening about 4 to 5% of the population that should be screened for lung. So that's where it is. For those who are screened and they detected a lung nodule, this technology will allow us not only to make diagnosis, but in the near future to allow us to diagnose and treat the patients minimally invasive. The technology that's coming ahead is what we call nanoparticles, and I had experience with treating some of our patients, diagnosing some of our patients in my previous position. And I think the combination of what we call the optical, the interventional pulmonologist with the pharma delivering drugs intratumoral, it will be a game changer for our patients. Again, changing the survivorship of our patients. And I think that's why we're so excited with this technology.
That's awesome, and that's exactly what we need for the patients of Florida and across the country, really. So what makes the Monarch special or unique compared to other diagnostic?
Right, so we for the last 12 months, we had the opportunity to review competing technologies. All of them are very similar. Some of them are old technologies with a new face. Others are newer technologies, but Monarch allow us to have visualization at all times of the nodule or the lung mass that we're to biopsy and treat. What I mean by that is, like, if you drive in your car and you also have the GPS, right? So you drive in your car and you're looking at the road, but when you get to your front door, all of a sudden it's dark, it's black, and you have to park your car inside the garage looking at your GPS. This is the other way around. This will allow you to drive your car inside your garage looking at it all the time. In other words, this system will allow us at all the times with the GPS, but also with a direct visualization of the tumor. And that's what makes it so exciting, so different than the other technology that we are assessing.
That sounds absolutely amazing and just really revolutionary. And it sounds like this is also pretty revolutionary coming here. We're at AdventHealth Celebration today. This is pretty revolutionary for this area too, isn't it?
Yes, that is correct. So I have to tell, we have a great team of providers and for the administration as well. And I know they all work very hard to get this technology here. For one, we also have a responsibility with our constituents to what type of technology are we going to apply and acquire and apply. So I know there's a lot of people behind the scenes that they don't show up most of the time. We did an excellent job in evaluating really our cost and benefit for our patients. At the end of the day, Monarch came ahead of every single topic that we analyzed. So yes, it's a new technology. We're excited for it because we're tied in with the lung screening program in Central Florida. Once we get the patient screened, sent to us, then we'll be able to have accurate diagnosis, early treatment. Those three combinations improve survival, and that's what we're all about.
Absolutely, and I like that you brought up early detection and screening. Now, the guidelines for lung cancer screening were recently expanded. Can you maybe share with our viewers a little bit more about that?
Yeah, so I would just review some of the articles in the CMS that approves now to pay for patients with high risk for developing lung cancer. So one of the things that we looked into it was when breast cancer screening started, most of the insurance companies wouldn't pay for that. But through advocacy and patient relationships, they were able to develop a system by which now almost 90% of the breast cancer patients are screened. So again, we're not there yet with lung cancer, but the CMS approving that payment for lung screening will be for sure a game changer for our patients. The ability to go to your doctor, get a low density CT scan for your screening and be paid by CMS, for us is a huge impact in patient care. That's number one. Number two, as we all know, once the CMS tells it is reimbursable, private insurers will follow suit. And that's what we wanted to do. We really want to spread this across the borders, bring awareness to our patients, those who smoke, family who smokes. We usually say, if you want to give your loved one a gift for Christmas, give them a CT scan. But let's be proactive, let's diagnose. But the fact is, people have to pay out of their pockets. Up until now, from moving forward with CMS, that's going to be a reimbursement. That's for us is a fantastic opportunity.
It really is. And if you have questions about whether you are eligible for this screening, of course you can contact AdventHealth. That they have amazing navigators who can help to answer those questions. The American Lung Association also has the Saved by the Scan campaign, which is a self-guided quiz to help you really determine based on your smoking pack history, because that can be a little confusing for people to do that math. We do have a goal at the Lung Association. Nationwide, we've had over 750,000 people take this quiz to see if they are eligible. By May, where we have Lung Force and Turquoise Takeover, we want to get to 1 million. And we know that barely scratches the surface here in Central Florida alone. So.
But I tell you what I usually tell my patients, which is, if you're 55 or 50 years old and you smoke, you just didn't start smoking. You've been smoking your whole life. So you're 50 and smoke, you will qualify for a lung screening. Make that easy. If you're smoking by the age of 50, you most likely you qualify. Don't try to do a math, 2 packs, 3 packs, half a pack. I stopped a year ago, I stopped when I got married, then I resumed again. Forget about that. If you're 50 and you've been smoking, you qualify for a lung screening program.
There you go, just talk to Dr. Silva if you have that history. This has all been really fantastic information. It's very timely with the coming of the Monarch, our push for screening more people for lung cancer and early detection, because we know that saves lives. So.
Absolutely. I'm confident, and I usually have the same message for my patients. Patients come in with a diagnosis of lung cancer, and for a lot of them, it means a death sentence. It's an awful diagnosis to have, and I usually say, no, that's contrary. We can treat you, we can extend your life, and most importantly, we bring hope to our patients. Where there's hope, anything's possible. And with our new technology, lung screening programs, our superb clinicians, we're here to help anyone in Central Florida and hopefully in entire Florida.
Absolutely. Yeah, I received a voicemail 2 days ago from a patient who had been seeing all of this marketing around low-dose CT screening for lung cancer. They finally took that step, and the voicemail said, "This saved my life."
Fantastic. There we go.
Yeah. So we want to hear more stories like that. So please, if you have any questions at all, of course, you can visit lung.org, contact our lung helpline. You can always reach out to our great friends here at AdventHealth. Dr. DaSilva, absolutely amazing information. Anything else
Thank
you
you.
want to add on?
No, we have locations across Central Florida. We have 18 hospitals, many central care. So please access AdventHealth. Please don't wait. Be proactive. We usually say the most important thing about your healthcare is you. Take charge of healthcare. Look for your physician, your primary care physician. Get that referral. Come to see us with your CT scan. We'd love to see you.
Well, thank you again for joining us. Again, I'm Janelle Hahn from your local American Lung Association. And remember, when you can't breathe, nothing else matters.